The liver is considered an accessory gland of the digestive system. It manufactures bile, which it sends through the liver ducts into the gallbladder. And from here, the bile is pumped, when needed, through the choledochal canal into the intestine, where it has the role of facilitating the digestion of dietary fats. So liver diseases concern both the liver, like hepatitis, cirrhosis, and liver tumors, as well as the bile ducts, such as cholecystitis and angiocolitis. Viral hepatitis, also called epidemic hepatitis, is an infection of the liver cells with different types of viruses. Thus, the type A virus is transmitted through the digestive tract via water and food contaminated with this virus, eliminated by the sick through urine and feces. It is responsible for most cases of hepatitis, especially in children. Type B virus is transmitted through blood, through transfusions, through unsterilized needles and syringes contaminated with the virus, through surgical operations, less often through sexual intercourse and through the digestive tract, and is more common in adults. Hepatitis B virus is more severe than virus A. Type C virus is transmitted both through the digestive tract and through the blood and is similar to the non-A non-B virus. Recently, hepatitis with viruses has also been described of type D and E. The incubation period of the disease varies, depending on the type of virus, from 30 to 60 days and even 3 to 4 months for the type B virus. Viral hepatitis is more common in children and adolescents, especially in summer and autumn, and often occur in an epidemic. But there are numerous cases of disease that are apparently unrelated to epidemics. The disease begins with uncharacteristic signs: nausea, vomiting, lack of appetite, bitter taste in the mouth, loaded tongue, headache, muscle and joint pain, fatigue, fever. The liver is enlarged, due to which the patient feels a painful pressure on that organ. It is only after the yellow coloration of the skin, or jaundice, that anyone can make the diagnosis, the people calling the disease jaundice. Jaundice is found mainly in the eyes, the skin of the neck and chest, and is due to the passage of liver bile into the blood. Then the bile from the blood is eliminated through the kidneys into the urine, which is why the urine is dark and foamy, even before the appearance of jaundice. It should be noted that not all cases of viral hepatitis are manifested by jaundice, these being the most dangerous because they cannot be diagnosed, treated, and cured correctly. As a result of the passage of bile into the blood, it no longer reaches the digestive tract and therefore also the feces, and because of this the stool is discolored gray. Since jaundice is also observed in other diseases like cholecystitis, gallstones, tumors of the liver and pancreas, cirrhosis, and poisoning, viral hepatitis will be suspected when there is an epidemic or when the patient has come into contact with a person with hepatitis. If the patient had some medical tests done 4 to 5 days before the jaundice appeared, then the disease would be discovered and treated earlier. Thus, serum transaminases, and especially pyruvic glutamate transaminase, lactate dehydrogenase have very high values, and a positive reaction to urobilinogen is evident in the urine. Transaminase values can increase more than 10 times. The urobilinogen formed in the intestine by bacteria from urobilin can be false negative or normal if a treatment with antibiotics that destroy intestinal bacteria has been done before. Of course, these analyses are much more positive after the appearance of jaundice. In addition, total blood bilirubin, aldolase, alkaline phosphatase, thymol reaction, Gross reaction, Takeda-Era reaction have increased values. Blood serum electrophoresis often shows a decrease in alpha globulins. In the urine, in addition to urobilinogen, bile pigments, which come from the bile passed into the blood, are highlighted. This explains the increase in bilirubin in the blood. Prothrombin time in some serious cases is prolonged because prothrombin synthesis by the liver is deficient. The patient with viral hepatitis is admitted to the hospital both to isolate him so that he does not infect other people and for a correct treatment to prevent the transition of the disease into chronic hepatitis. After the clinical cure, the patient, as indicated by the doctor, will have to follow a drug treatment and a special diet for a long time. Prevention of hepatitis in people who have come into contact with a hepatitis patient, especially with virus A, can be done by injecting gamma globulins. Chronic hepatitis. Incomplete healing of viral hepatitis or hepatitis of another origin Non-compliance with the prescribed treatment, diet, and rest regime favors the chronicity of the disease. Other infections or intoxications of the liver can also produce chronic hepatitis. Chronic hepatitis can be inactive, lasting for decades, or active, which continues to slowly and permanently destroy liver cells. In both situations, with time, cirrhosis with liver failure is reached. Chronic hepatitis is favored by infections of the biliary tract and some intoxications, especially with alcohol, as well as by not detecting and treating in time a mild viral hepatitis or without jaundice. The symptoms of the disease are similar to those of acute hepatitis, but of lower intensity: reduced appetite, loaded tongue, nausea, vomiting, bloating after meals, fatigue with little effort, jaundice or subicterus, painful embarrassment under the ribs on the right side, decreased weight, less often hypofebrile conditions, mild anemia with pallor. In relation to the stage and severity of the disease, the medical analyses reveal important disturbances. The reaction to thymol is intensely positive. The serum albumin is very low while the globulins are increased, so that the albumin-globulin ratio falls below 1. Among the globulins, the gamma globulins grow the most, even over 30%. Chronic hepatitis is frequently associated with increased immunoglobulins A, G, and M. Blood bilirubin is elevated, as is urinary urobilinogen. A decrease in red blood cells is also found, and the erythrocyte sedimentation rate is moderately increased, especially if a microbial infection of the biliary tract is also superimposed. All these changes and disturbances of normal liver functions eventually lead to chronic liver failure. These, in some cases, end with liver cirrhosis. Chronic hepatitis is treated with drugs that protect the liver amino acids, vitamins, silymarin, and so on. The diet will be suitable for the stage of the disease of each patient. It is recommended to avoid great physical and intellectual efforts, plenty of rest, and mineral water treatment. The use of alcoholic beverages is prohibited. Cirrhosis of the liver. Liver cirrhosis represents a more advanced stage of chronic hepatitis and liver failure. The disease has a long evolution over decades and is mainly the consequence of an older, improperly treated viral hepatitis and alcoholism. It should be noted that not all chronic hepatitis ends with cirrhosis. There are two forms of cirrhosis, with a small liver, in 3/4 of cases, and with a large liver. Cirrhosis manifests itself when the insufficient liver can no longer cope with the synthesis of nutrients for humans, when it can no longer break down and eliminate the toxic waste resulting from the body's activity, and when the blood circulation through the liver is hindered due to the sclerosis or shrinking of the liver. The disease evolves slowly, sometimes without the patient's knowledge, especially if he has never suffered from liver disease. In the beginning, the symptoms are similar to those of chronic hepatitis and come from the digestive system: capricious appetite, indigestion, bloating after meals, less often nausea, vomiting, diarrhea, nosebleeds, gums bleeding, vomiting blood. Then the patient eats little, loses weight, shows weakness and fatigue, and decreases his work capacity. As the blood flow through the liver becomes more sluggish, some of the water in the blood spills into the abdomen, forming ascites. The abdomen is enlarged, and the removal of fluid is followed by its rapid recovery. In the blood, white and red blood cells decrease, as well as platelets. Also, total proteins, serum albumin decrease, while globulins increase, so the albumin-globulin ratio is very low, below 1. The proportion of gamma globulins reaches up to 40%. This causes the decrease in liver synthesis, decreases the prothrombin time, which favors bleeding, and decreases the production of fibrinogen and cholesterol. Thymol test, gross reaction, Takeda ARA and others, as well as serum bilirubin are intensely positive. Among the enzymes, transaminases, lactate dehydrogenase, alkaline phosphatase are increased, while cholinesterase is decreased. In an advanced stage of cirrhosis, the concentration of ammonia in the blood also increases. In the urine, urobilinogen and urobilin are present, and in some cases, albumin is also detected. Also, the concentration of 17-ketosteroids in the urine is low. Hydatid cyst of the liver. As with pulmonary hydatid cyst is due to the development of the larva of the Taenia echinococcus parasite in the liver. Almost 3/4 of hydatid cysts in the body are located in the liver. The disease is often found in sheep and cattle breeders, as well as in dog owners, the dog being the one that eliminates the eggs of the parasite on the soil, vegetation, and water, sources from which humans become infected. Wolf, fox, and cats less often eliminate parasite eggs. The cyst is spherical in shape and looks like a ball the size of a large orange filled with a clear liquid. The symptoms of the disease depend on the volume of the cyst or its rupture. For many months, the cyst evolves without symptoms, and only a radiological examination can discover it. When it enlarges, the cyst causes compression on neighboring organs, producing pain and heaviness in the liver. The diagnosis is made by the laboratory, which reveals either antibodies in the blood through the Weinberg-Parvu reaction or anticol in the skin through the Cassoni reaction. This reaction consists of injecting fluid collected from a hydatid cyst into the skin of the forearm. A strong redness at the injection site after 20 to 30 minutes indicates a positive reaction. The Cassoni reaction can be false positive if the person has had such an injection before. A high percentage of eosinophil cells is also found in the blood. If the cyst ruptures and its contents reach the gallbladder, lungs, abdomen, or other organs, the symptoms vary with the suffering of the respective organs, and only the doctor can specify the diagnosis. In such cases, various pains and secondary infections occur with laboratory signs specific to the respective bacterial infections.